Tolulope, Osayomi. I teach at the Department of Geography, University of Ibadan, Nigeria. I am the founder as well as the director of the COVID-19 Mapping Lab here at the Department of Geography, University of Ibadan. This video lecture, I must say, is based on one of our many publications which you can see on the right-hand side of my screen. The publication is entitled A Geographical Analysis of the African COVID-19 Paradox, Putting the Poverty as a Vaccine Hypothesis to the Test. This publication, you would say, is a child of circumstance and a response to the controversial BBC Africa post on the possible explanations why Africa was the least affected by the COVID-19 infection. Just to provide a bit of context to this lecture, as you all are fully aware, that on the 31st of December 2019, coronavirus infection was detected in the wet market at Wuhan, China, and 3 months after its emergence, a pandemic was declared by the World Health Organization, and since then it has actually compelled humanity to reconsider and reorganize its ways of living. As you can see on the screen, this is the global distribution of the COVID-19 across the world. We have very high, we can see that there are large number of infections in North America and also in Europe. And if you were to have a closer look at Africa, you would see it appears that Africa is the least affected by the COVID-19 pandemic. And of course, this casual geographic observation gave rise or has given rise to the phenomenon we characterized as the African COVID-19 paradox. As of August 4, 2020, there were over 18 million cases of COVID-19 and nearly 700,000 deaths arising from this infection. As I earlier pointed out, Africa was, and it still is, the least affected, while Europe and North America bear a significant burden of this public health crisis. But it still remains a mystery why Africa is the least affected. But before the virus ever got to Africa, there were speculations that the virus would not be able to access Africa, so to speak, because of Africa's tropical climate. But contrary to speculations, the first case was recorded in Egypt on 14th of February 2020, and ever since then, Africa, and even up to date, Africa has the lowest rates of infections and deaths. It's just so interesting to see how a casual geographic observation has grown to become one of the mysteries of this COVID-19 pandemic. And of course, this actually formed the basis of our inquiry. Prior to the virus arrival to Africa, there were several predictions, several projections and estimations on the possible impacts it would have on the continent. And I will just share a few. And the first is that the United Nations Economic Commission for Africa had projected that 1.2 billion cases and 3.3 million deaths would occur on the continent if there was no response at all. In addition to that, Melinda Gates, in an interview with CNN, emphasized that Africa would, record a high body count on its streets, given the challenges, the socio-economic challenges the continent faces. And also, it was also projected that this public health crisis would put many more Africans into poverty. Of course, the question till to date is, why was Africa spared from the impact of COVID-19? And as you can see from the screenshots of several newspaper reports, the one that really would catch your eye is that of Bill Gates, in which he said, "We do not know why COVID-19 cases deaths are high in Africa." I mean, this just represents some of the mood of the world as why Africa had the lowest rates in the world. And of course, this is also based on the fact that Africa is, based on the fact that it stems from Africa's current development status, which is largely characterized by widespread poverty, um, high infectious disease burdens, as well as a growing non-communicable disease prevalence, and also poor governance, which is also typified by military coups and widespread corruption. Not long after this, the BBC issued a post which was entitled, "Could Poverty Explain Mystery of Low Death Rates?" And we're referring to Africa. And of course, the canon of this controversial post was that poverty could poverty actually confer some form of protection or immunity for African households against this highly contagious infection? And of course, this, of course, gave rise to what we at the lab characterized as poverty as a vaccine hypothesis. And of course, this, as many of us know, received a widespread backlash because it was seen to be a severely harsh assessment of Africa and its people. And of course, this was coming shortly after the outright rejection of suggestions that prospective COVID-19 vaccine should be tested on Africans, which came from two French scientists. Uh, Despite the backlash it got, we at the lab saw an opportunity to actually test the validity of this hypothesis. And we were hoping that it would, provide fresh insights on the African COVID-19 paradox and also possibly raise new questions on this phenomenon. So the key question of our inquiry was, to what extent does the spatial distribution of COVID-19 reflect the variation in poverty across Africa? So we were more particular about, do countries with high levels of poverty have low COVID-19 morbidity and mortality rates? So in the bid to address this question, we produced 4 scatter diagrams just to depict the nature and the strength of the relationship between this infection and poverty using 2 indicators, namely poverty incidence and human poverty index. I want to place emphasis on the fact that we were more particular about the levels of explanation, how much of poverty could, could, could account for the incidence and mortalities. These maps, the first is a map showing the distribution of incidence rates, and on the right is showing the distribution of death rates, all associated with this infection. And you would see, a very simple look would tell us that generally speaking, the rates are very low, except for a few countries, and you would see that there are marked differences across the continent, and you will see that countries such as South Africa had the highest in terms of morbidity and mortality in the continent. Our findings were very, very interesting. The first was that we've somewhat validated the hypothesis. And what do we mean by that? We actually found out that there was a negative relationship between COVID-19 and these poverty indicators. And I will just take them one after the other. Now, the first is if we were to look at it along with respect to infection, you would see that we found that there were some countries that had high morbidity but low poverty rates, and such countries are Djibouti, Cape Verde, Gabon, South Tome, and Principe. And on the other hand, we had there were countries who had high poverty levels but very low infection rates. With respect to mortality, there were high mortality rates but low poverty levels in Egypt, Mauritania, Algeria. Um, on the flip side, we would see that there was high poverty but low mortality in countries such as the Central African Republic, Guinea, Malawi, and Madagascar. Um, with regard to the levels of explanation, we would see that the proportion of COVID-19 being explained by poverty was very low. And the level of explanation ranged from 0.08% to 14% of the variation in COVID-19. And I mean with respect to mortality and incidence. So this, of course, the import of this is that these are weak explanatory models, and they don't actually, to a very large extent, account for high poverty does not really account for the low rates of infection and death. And these are the scatter plots I mentioned earlier. You would see that some parts of Africa, such as South Africa, was a big outlier. You would see the little dots at the top of each of these graphs here. That's South Africa, and you will see that there's a very large cluster at the bottom of these plots. Um, for us, it was intriguing to see that there were two countries that caught our attention, and one is Nigeria, because shortly before the arrival of COVID, it had been tagged as the world's poverty capital. And it was interesting to see that it had one of the lowest morbidity and mortality rates. But on the other hand, South Africa had the highest COVID-19 infection and mortality rates, but low poverty rates. So what really intrigued us was that despite the fact that South Africa has one of the best healthcare systems in the world, in Africa, and also has a comparatively strong economy, it was surprising to see that it had a high uh, COVID-19 infection rate and also death rates. So these observations or these results reinforced the special mismatch that's between this infection and the poverty observed among these African countries. And to some extent, from an analysis point of view, would say that this hypothesis was somewhat validated. But we still felt that our inquiry has not fully answered the question: why does Africa have fewer infections and death rates than the rest of the world? Of course, this is judging by the level of explanations that I had mentioned earlier, showing that a very low proportion of COVID-19 is being explained by poverty. We did conclude by saying that it's actually beyond poverty, that there are a myriad of factors that could account for this COVID-19 puzzle, some of which are prayers. Some have alluded that prayers have reduced the counts, infection counts, and also previous epidemic outbreaks as a sort of, provided some immunity to the continent. And also some still hold on to the the fact that the tropical climate could actually serve as a big barrier, an effective barrier to the spread of the infection, and also to early preparedness, uh, in a way, prepare the continent to prepare for the worst. Um, so unfortunately, these many of these explanations were not quantifiable, but we did agree, we did conclude that it's not there's more to it than just poverty. And our conclusion was that poverty doesn't protect against COVID-19, and it does, and as well doesn't provide a significant explanation to this COVID-19 African COVID-19 mystery. So we did leave a few recommendations. The first was that we felt that there's a need for further research on this mystery at finer geographical scales, because this study was done at the country level within Africa. And also we decided to draw the attention of our readers to what I could call the Western world anomaly. And that is, why do the economically advanced countries, particularly the Western world, as we saw in the global distribution map, have the largest numbers of COVID-19 and infections? I think that is what the world should be more concerned about, so as to reduce these infection rates to the barest minimum.